Hi, Sally Walker here, your hormone and slow age expert. So why is vaginal pH so important? So what does that mean, pH, parts of hydrogen? It's all about how acidic or how alkaline a fluid is. So we're talking about the fluid in your vaginas. Now, we need it to be quite acidic. Somewhere around 3.8 to 4.5 roughly is what we would like it to be. We do know that the aging vagina, it can be up around 5, okay? But you do not want it going higher, okay? So why not? Well, the pH is, or the acidity is all part of the immune system. Actually, it's gonna help you kill the bad guys, kill the bugs, because your vagina is the entrance to your body, and we don't want anything getting into the body which is not body friendly, basically. So the pH is part of the immune system and helps this to happen. Now, this is maintained partially by the different types of healthy acidic producing bacteria, your vaginal microbiome, which, by the way, talks with the biome in your gut. And then the fluids that your vagina is producing also contain acids. So those two things maintain your vaginal pH. So as we age and estrogen levels drop and we don't produce the fluids as we did before, then we do see an increase in pH. We don't want this, ladies, because you're setting yourself up for recurrent bladder infections, cystitis, other infections in your vagina, etc. We really don't want to have this. And estrogen replacement therapy, vaginal estrogen therapy, is the way forward for this, absolutely. And it will also increase the lubrication produced, your body's natural lubrication, so the lubrication produced by your cells. So you'll be more lubricated, and maybe you don't need to use another lube at all and worry about the chemicals in that. So estrogen is absolutely my first choice of treatment related to vaginal health, okay? So keeping that pH is very, very important, acidic as possible. So the pH level is affected by different things. So let's have a little look at this. So we've got the menstrual cycle. So through your menstrual cycle with the changes in hormones, definitely with the drop in estrogen, you will be at more risk of having a higher pH. Pregnancy, menopause, absolutely, as I was saying, that after menopause or during the perimenopausal time, estrogen levels are lower and you have an increased risk of having a higher pH and start getting more infections. I hear of many ladies saying very often that they have cystitis or they have bladder infections all the time. Go to the doctor gives them some antibiotics or some sulfo, and it's okay while they're taking them, and as soon as they stop taking them, the infection comes back. And it's because you haven't fixed the problem. You might possibly have made it even worse by taking the antibiotics, because you possibly killed off some of these bacteria, these acid-producing bacteria, which will keep the pH low. So it is not the solution to have antibiotics to treat your bladder infections, but it can be necessary. I'm not saying that you shouldn't do it, but I'm saying you shouldn't be doing it again and again. You need to fix the problem. And the problem is that your pH in your vagina is too high. So the pill can also, so the birth control pill can also affect the pH levels. And then what are you cleaning yourself with, ladies, okay? And are you doing this douching? So you're spraying or injecting things up in your vagina? So let me just give you a tip here. Your vagina is perfectly capable of cleaning itself. You don't want to be putting things up inside your vagina, because these things, these chemicals, are going to affect your pH level and much, much more. So be very, very, very careful of this. And also be careful of the lubricant. So if you're using a lube, have a little look on the bottle and see what the pH is. So you don't want a lube that has a higher pH than 4.5, okay? And if it doesn't tell you what the pH is, don't buy it, because the likelihood is that it will have a higher pH. Okay, so if you wanted to know what your vagina pH is, you can actually do some home testing. You can buy a test kit in the chemist, possibly in Boots and places like that, where you can test the level of your pH, so you can see that it's nicely around those 3.8 to 4.5 max 5. Yes. And as I said, estrogen is going to decrease that pH nicely, bring it down around the 4.5, max 5 for you postmenopausal ladies. Happy hormones, happy life.